Dr. Fauci, thanks for joining me. Happy World News Day.
Thank you. Good to be with you.
What's your approach to the news media throughout this pandemic? How would you describe your approach?
Well, I have a very good relationship with the news media because, as a public health official and a physician scientist, as director of the organization that's involved in developing the vaccines and the drugs for COVID-19, given this particular really public health crisis that we're in, it's very important to get accurate information out to the public based on scientific data and solid evidence. And working closely with the media is an extraordinarily critical way of getting that information out. So my relationship with the media and my interactions with the media, I think, are critical to my job, my function of getting the proper and appropriate and correct information out.
My impression is that you've had an all of the above strategy, where you were on Good Morning America earlier today, and now you're here with me. You've been on webcasts, podcasts, everything. Is that right? It's an all of the above strategy?
Well, yes, it is. And I think you really got to try and be out there in a consistent message as often as you possibly can, because there is so much, misinformation during this very divisive time that we're in. And the public really needs to know the facts in going through this extraordinary experience that we're all going through.
Yeah. Are there specifics you feel you've learned about the media this year? And you've been in this course for decades, but is it different this year? Are the things you've learned?
Well, yeah, I have been interacting intensively with the media now for at least 36 or more years since I've been the director of the Institute. The one thing that's different right now is some of the media that I deal with really kind of, I wouldn't say distort things, but certainly give opposing perspectives on what seems to be a pretty obvious fact or a body of data. So I try not to get too perturbed by that, but it's you know what I'm talking about when you listen to some networks.
What's the most pernicious example of that?
Well, I think if you listen to Fox News, with all due respect to the fact that they do have some good reporters, some of the things that they report there are outlandish, to be honest with you.
Yeah, there's been a lot of talk about, especially in the primetime shows, about masks not being effective. What do you want people to know about masks?
Well, if you look at the scientific data, the masks are clearly work. They are part of a multifaceted approach of masks, keeping distance, avoiding crowds, washing hands, doing things outdoors much more than indoors. All of that is a combination of prevention modalities that are easy to do, relatively speaking, and you can accomplish some of the things that you want to about opening up the economy, and you can actually do that in a prudent and careful way.
Right, it makes it possible for me to go into Starbucks and go ahead and spend a few dollars if I'm wearing a mask. But here's the game that these hyper-partisan websites play. They'll say, hey, Dr. Fauci, you advised against masks last winter, so you're a hypocrite and we shouldn't listen to you. What do you think that's about? Is it about taking snippets of sentences and just trying to smear you like that? What's that about?
I don't know what it's about, but it's very disconcerting, Brian, because it's very clear what I think whoever does these things does not appreciate is that science accumulates evidence and data. And at any given moment, when you're having an evolving situation like COVID-19, which clearly is evolving in a very rapid way, you make a recommendation or you make a policy based on the information that you have at a particular time, such as early on in the outbreak in February and March. As you get further information, you have to be humble enough and flexible enough to make your statements and your policy and your recommendation based on the evidence that you now have,
Right.
which may actually change some of the policy. And the typical example that I think you just were alluding to was the issue with masks, that at a time when it was clear that when people were running to get masks, that wasn't enough masks for the people who were taking care of sick individuals, namely healthcare providers. So we were not recommending that people wear masks. And then something else happened. We learned that about 40 to 50% of the individuals who are infected are without symptoms. And then we learned that a substantial proportion of the transmissions occur from an asymptomatic person to an uninfected person. So when you put those two things together, when there was no longer a shortage of masks, it was clear that cloth coverings in many respects were just as good as surgical masks. And when it became clear that anyone could be infected, even someone without symptoms, so the idea of staying away from someone who has symptoms no longer held true. Anyone could be infected, even yourself, without knowing it. So we went from not recommending masks to very, very strongly recommending masks. And that was based on evolving scientific knowledge. But some of the media who like to make hay of that keep saying, oh, you keep changing your mind all the time, or you were incorrect. Well, no, we were correct at the time that that statement was made. But when the scientific data made it clear that we had to change that recommendation, we did. But
those
that's
clickbait
not the way it
stories,
gets reported.
right, those hit jobs, that's a literacy problem, really. But setting aside those hyper-partisan media outlets, I think you're making an important point about science and journalism. Science evolves, journalism has to evolve as well. We have to keep up with what you all are learning every day.
Yeah, I mean, as you were talking about the media, I mean, as I have seen, there are reporters who really, do a great job. And even Fox, even on the Fox channels, there are some that are really, really good that I totally respect. But there are others that just, anything that I would say, they'll distort a bit. And I'm not sure there's anything I can do about that.
For someone tasked with managing the public's health, do you think social media is mostly beneficial or mostly detrimental this year amid the pandemic?
It's a mixed bag. Brian, I don't know if I'm qualified to make a judgment on that because I'm so busy. I don't tweet. I don't have a Twitter account. I don't do social media, but obviously I'm aware of it and I see it. At its best, it can disseminate important information widely, but at its worst, it can disseminate absolutely incorrect information widely. So it's sort of a balance there. It's a mixed bag.
Yeah, it's very hard to know. In a health crisis, broadly speaking, how have you tried to separate science from politics? That's our big picture question for World News Day.
Well, what I do is I stay out of politics. I mean, I have to get involved in policy that's based on the science of which I am responsible for and that I may be a subject matter expert on. But people need to understand my entire career of dealing with the public with regard to interacting with the media and the press and representing the scientific community, I have completely stayed out of any political ideology. In fact, people who've known me for the 35, 40 years still have no idea what my political ideology is because I never, ever express it or let it get involved in anything I do, which is the reason why I've been able to successfully get along with 6 presidents that I've had the privilege of advising over the last 35, 40 years.